Good evening and welcome to I'm Chris Parnell.
Reporting from Moscow.
Tbilisi.
Times Square.
May your dreams be your only boundaries in life.
Hello, welcome to Mentors. My name is Tracy Speake and I'll be your host. Webster's defines mentors as wise, loyal advisors. This program, Mentors, seeks to serve as a forum for seniors to share their wisdom with Memphis and the surrounding locale. We hope to address the life issues that seniors face. Mentors are wonderful people that make significant contributions to the quality of life within the Memphis area. Mr. Jim Moffat, advertising manager of the Best Times, will present our calendar for the month of November for the area. These are the upcoming events and happenings that can enrich our lives. If you live in the South, and especially here in this part of it, there's a great possibility that you will have terrible sinus problems. We want relief as quickly as possible. Dr. Jan Petrie is an ear, nose, and throat physician who practices in this Memphis area. And she has a new procedure that can be done in her office that can bring relief. This avoids hospital visits and loss of work time. And she's here to share this with us. Welcome, Dr. Petrie.
Thank you for inviting me. It's a pleasure. I am so excited about balloon sinuplasty. People have never really heard the term, so it doesn't mean a whole lot to them. But here in the Memphis area, we've been doing this procedure in the office for a couple of years now. And it is a quick back to work. There's not a lot of downtime, as you mentioned, and it dramatically improves things for patients.
And for many folks, they don't have to have general anesthesia, I would think.
Absolutely. And how many people have gone to their doctors and they've tried this medicine or that medicine and nothing seems to work?
I'm holding up my hand.
Yeah, well, then you may be a candidate. It is a office procedure that takes, maybe an hour. We spend a lot of time getting you numb, so in that way it's like going to the dentist. And then basically use a little balloon to help open the sinus cavities.
A balloon?
Mm-hmm. It is the same balloon that they use in the heart arteries. And so if it's gentle enough but effective enough to work there, it's going to work in the sinuses as well. The statistics are terrific about how long it keeps your sinuses open. The studies indicate that it's a forever procedure. In other words, if we do this procedure tomorrow, we expect in 3 years that it's still going to be open.
So it's not just right this red hot minute and 30 days from now you got to come do the same thing.
Exactly. But I'd like to talk a little bit about the people that are good candidates for this.
Okay.
Certainly the people that get sinus infection after sinus infection. There are those people that go to their doctor 5-6 times a year and get an antibiotic, a sinus cocktail shot, and then they're better for a little bit and then they're right back. There are also people that have symptoms of what we call barosinusitis, which has to do with how much pressure and pain and congestion that they constantly get. Some of those people, it's aggravated by allergy, and we're one of the allergy capitals. We're number 2 in the United States for having allergy problems. So all of those things together we take into account, and we usually get a CT scan and look at the patient's anatomy, look at their history, put it all together and decide if you're a candidate or not.
So it's a procedure that has its basis of such things as heart catheterization and all these other things and balloon
Right.
type of sympathy.
And I brought a little animation today, and it basically shows that we use a little guide first to go into the sinus, and we're talking about an opening that's maybe a millimeter. Okay.
Wow.
Thread the guide into the sinus, and then thread the balloon device, and then inflate the balloon. And then once we take the balloon out, which we do, by the way,
Oh,
we don't
well,
leave it in there,
that's
and we
good.
take the balloon out, and then the sinuses are 5 to 7 times bigger, depending on the size of balloon that you used. So, and I actually brought one of the devices today. Now this one actually already has the balloon inflated.
Okay.
And so when we tend to think about a balloon, we think about a party balloon, and you can push those down, and they're not very strong. This is a medical grade instrument. That balloon, remember, the balloon's all together, and then it's inflated, so it's strong enough to move bone and tissue. That's why the results tend to be long-lasting. So this balloon is not compressible. I cannot push it down. So what we routinely do then is open the affected sinuses, and again, we expect those results to last. The other good thing here in the Memphis area is that most of the major insurers, including Medicare, tend to think it's a great procedure. It's a great procedure because you can do it in the office, and the results profile has been extraordinary.
So when you're talking about doing the sinus, I assume that there are more than one sinus on each side. So
Right.
how many sinuses do we have?
Well, there are 6 sinuses that are applicable for this procedure.
Okay.
There are the 2 in the cheeks, 2 in the forehead, and 2 way back. So
okay.
those are the ones that the balloon device is targeted to. There are certain people in certain conditions where you couldn't do this, but it's particularly good for people that have lots of medical problems. Let's say you have sleep apnea, diabetes, heart disease, some of these other things. We're capable of doing this in the office and being able to offer relief to these patients. I've even done patients that were pregnant. They couldn't go back to work because they were all infected. You can't take a pregnant person and put them to sleep. So with this technology, it's been a godsend for a number of people. The other thing, like I mentioned, most of the insurers cover it. And for some, it's just an office copay. For others, it could be pricier, up over $1,000. But, and nobody likes that, but these big deductibles, I think, are kind of getting everybody these days.
Well, one of the great things is think of what you say by not having to go into the hospital.
Oh, absolutely, and the fact that you feel better.
Yes, yes, and with this sinus season upon us, how many months is it? I think we've already been through 4 or 5 months in Memphis. What do we have to look forward to?
Well, our main sinus season is just starting,
Oh,
and people
boo.
tend to have more trouble,
Oh, boo.
throughout the winter months. And so, we're in the sinus capital.
Okay, and if it's done in the office, as you point out, the various plans do pay for it, but you certainly should check before you have it done.
We check for you. We want to make sure that we treat you for whatever problem you have, okay? And if you're a candidate for this, we basically check with your insurance company and see what the ramifications are financially. But again, the seniors, Medicare tends to love this procedure.
Well, particularly as a senior, I think there are a whole great number of people who are very concerned about being put under general anesthesia, and they're not going to do that unless it's just something ultra life-saving that takes place. So with this, it's just a general anesthetic.
It's a local anesthetic.
A local anesthetic.
It
yes.
is. We call it like going to the dentist, but without the drill.
All right. When we come back, we'll hear more about this procedure and about sinus. And we have a guest who has had this. It's going to come, Mr. Moss, and tell us about his experience with this. So Be back in a minute and you'll hear more.
You can now watch your favorite Germantown community television shows from anywhere in the world. GHS-TV is streaming online, live 24/7. A viewing screen displays our channel just like you see on television. Simply visit our website at www.ghstv.org. So log on and enjoy hometown news from anywhere in the world, only at ghstv.org.
Now, we're getting killed on the boards. This is your territory, Grimson. Do your job.
Grimson. Hello? Oh, hi, honey. Al? All right. Itsy bitsy spider climbed up the water spout. Down came the rain.
I love you, Daddy.
I love you too, sweetheart.
Love. Pass it on from the Foundation for a Better Life.
Welcome back. Dr. Petrie and Pete Moss have some good suggestions and ideas for us about this procedure in a real live case. So, Mr. Moss, tell us about your experience with this procedure.
Well, I'm what you would call a very satisfied customer. I had continual problems, repetitive problems, breathing, sinus pressure, lots of antihistamines, lots of decongestants, and too many antibiotics. So I just decided that it was time to do something to take some positive steps to try to alleviate some of the problems that I was having.
I know your wife probably has appreciated it.
I think everybody appreciates it. You know, the way I look at it is whether you're young, whether you're old, whether you're working or not working, married or not married, you want a better quality of life. And for me, it was a matter of continually dealing with those problems and sinus infections. That was my big problem. And this time of year is particularly difficult. It was for me. And so all of those medicines and antihistamines and things that I would normally be consuming this time of year, I don't have to take. That doesn't mean I don't ever have to take it, but it's dramatically reduced.
Yeah, I think that's an important point, is what I try to tell people. It's not going to cure absolutely every sinus symptom, and it's certainly not going to cure your allergy, but it certainly does, as he said, improve your quality of life so that you're not constantly every day waking up thinking about, oh, what do I need to take for my sinuses today? And that's the way a lot of people live in this area. So I think for Pete, it's been a great procedure in that way. Do you have any feelings about how it was to go through that? A lot of people may go, well, I may want that and need that, but I don't know that I want to do something in the office.
Well, I guess the way I look at it is that, you know, what do you get out of it? And what I get out of it is approximately a year and a half later, I don't have to deal with those same problems. So with the local numbing that was referred to, and you know, you quickly recover from the procedure. For me, I can go on, here I am a year and a half later, not going through those same symptoms, and so it's definitely worth it.
Yeah, and a lot of people want to know about the recovery. I usually say, well, for sure take that day off, and if you can take the next day, better. But a lot of my patients go right back to work. Other people feel like, gosh, I have, you know, a little sinus headache or this, that, and the other for a while, but most people get a pretty quick response, and when they come back in about 2 weeks, it's like night and day.
Well, with everybody, and as businessmen, we always say, okay, what's the return on investment? And the fact that you're saying after this year and a half of this procedure that, you know, your quality of life has really changed and you're not having to go see about all the infections and, you know, and you're not having the cost of the antibiotics and build up resistance to them. And one of the things as as a constant, ongoing person, as you have with pharmaceuticals, is that you build up a tolerance to the various ones that are given, and you find yourself having to say, oh, well, I've taken that one, and obviously it's run its course, and we've got to go to this one, and it's run its course.
Well, and there are some patients that I'm sure doctors have said, there's not really anything I can do to help you. And I think for those patients, if their symptoms are bad enough, I've found that this procedure helps a number of those people. So to me, I would much rather, as a patient comes back, have them very happy because I've been able to do something favorable and productive and something that helps them, rather than, oh, I tried that and it doesn't work. So for me as a physician, it's been a wonderful tool.
Well, patients are not much into psychosomatic therapy of the sugar pill. That you have to have results, or people are not going to continuously come back to you. And even with the small number of ENTs, you want
Right.
to have happy patients, and the patients want to feel like something has transpired that's worthwhile.
Yeah, one thing I'd like to mention, Tracy, because somebody listening might say, well, where can I get more information about this?
Yes.
I've put up a website. It's called MemphisSinusReliefCenter.com. And a number of patients who have had the procedure have written in testimonials. And I tell patients, if you can read those and see what the patient's symptoms were beforehand and see what they felt like the procedure was like and how is it now. I mean, I have some people tell me, you know what, I am sleeping better. They never realized that their nose and their sinuses were waking them up all night long with obstruction. What kind of symptoms did you have that cleared that you were most excited about?
I think the sleeping was important. Obviously, you can sleep much better if you can breathe.
It helps along the way, doesn't it?
And so that's one of the major benefits, I think. And it does seem like you have more energy. You know, they have the nasal strips and things that help athletes breathe better. So just being able to get more oxygen helps you feel better.
Were you a mouth breather?
A lot, yes.
I'm a mouth breather, yes. And so you're just clogged up and snore, man, I can rattle those walls. So.
Well, we don't give any guarantees
No
on
guarantees
snoring in the
about
procedure,
snoring,
but
okay.
I've had some people
does
say
help.
it helped. It does help?
It does help, yes.
Good.
Well, anyway, you got a little more air, it's going to be helpful,
Sure
I'm
it is. Sure it is.
You don't want sleep apnea, I don't.
No, we've done this on sleep apnea patients, and sometimes it's just so even they can wear that CPAP better, and they don't get near as many infections, that kind of thing. So again, it's putting together a treatment plan for somebody. It's come in, let's figure it out, let's see if you're a candidate. So in that way, I think if we identify that you're a good candidate, and you do the procedure, then I feel like you're going to get a good result.
So we're saying, in essence, is that in fair balance, you're certainly going to have an improved lifestyle, and your sinus situation is going to certainly be a whole lot better in terms of the infection rates and all of that.
And we hope that for all patients. You know, you can get some people where maybe it doesn't work quite as well, but I'd say overwhelmingly it's been positive.
All right, so we have a new procedure, and Mr. Moss, thank you so much for coming and sharing. And Dr. Petrie, thank you for once again coming and taking your time. And we look forward to you coming back, and let's hope it's another year and a half and you're still doing well.
That'd be great.
Absolutely.
Thanks for you. When we come back, we're going to have Mr. Jim Moffat, who's going to be bringing our events and marvelous occasions that are here to come in the month of November. Stay tuned.
launched it over the span of 3 decades. We've dedicated ourselves to making it a fantastic community show, and the Alliance for Community Media has named GHS-TV's Crosstalk the best informational program in the country. From coverage of important area issues and events to conversations with high-profile local, national, and international personalities, Crosstalk keeps you informed and entertained. Don't miss Crosstalk, produced entirely by the students of Germantown High School. The news show airs each week only on Germantown Community Television, cable channel 17.
Wow. College already.
Yeah. We gotta go.
I love you.
I love you too, Daddy. And thanks for everything.
Gratitude. Pass it on. A message from the Foundation for a Better Life.
I'm Tracy Speake, host of Mentors, the show for Memphis and the surrounding area seniors. And with me is Mr. Jim Moffat, advertising manager at the Best Times, to present our calendar for the month of November for the area. Welcome. So tell us all about these wonderful upcoming events.
Oh, well, thanks, Tracy. There's a number of exciting events taking place for seniors during the month of November. Open house. We can celebrate Awareness Month with ADS on Tuesday, November the 4th at the Grayshot Center, 4585 Raleigh-LaGrange. That's inside Kennedy Park. Or on Thursday, November the 6th at Dorothy's Place, 3185 Hickory Hill, from 4 p.m. to 6 p.m. Founded in 1983, ADS has been serving the Memphis area for over 31 years. Germantown Senior Expo.
Yes, fond memories.
Thursday, November the 6th from 9 a.m. to 3 p.m. at the Germantown Performing Arts Center, 1801 Exeter, presented by the City of Germantown Senior Citizens Advisory Council. That is going to be an exciting thing. Party! Home Instead Senior Care cordially invites you to a special evening to celebrate 18 years of helping seniors in the Mid-South. Please join us at the Racket Club of Memphis, 5111 Sanderlin in Memphis. Hors d'oeuvres, wine, and beer. That's Thursday, November the 13th, from 5 to 7 p.m. Bazaar. The Solana Germantown is hosting a holiday bazaar on November the 18th. We're looking for vendors interested in selling their handmade crafts at the event. The event will be free and open to the public. There's a small booth fee that will be charged for with proceeds going to the Alzheimer's Association. Another holiday bazaar. Robinwood Retirement Resort invites you to a holiday bazaar on Saturday, November the 22nd from 1 to 4 p.m. Handmade crafts and holiday goodies, Christmas music and entertainment, and apartment and patio tours. That's at 2795 Kirby Whitten, right at Summer Avenue.
Mm-hmm.
The Christian Care Center of Memphis, or CCM, is a brand new skilled nursing and rehab facility currently under construction. The facility is anticipated to open in 2015 at 6500 Kirby Gate Boulevard. Martin Yeomans is the executive director, and Mindy Burns has joined him as director of admissions and marketing. How about some more information about the Germantown Senior Expo?
Well, that was really interesting. Is it started over 10 years ago. It got cranked up, and
well, you were heavily involved in that, weren't you?
Well, I'm glad to say that I was president of the Senior Citizens, or chairman of the Senior Citizens Commission here at Germantown, and we began this. And it was a crazy thing. They told us that, wow, we couldn't do that. Why, it takes too much work. So in a period of 1 month, the workers of that group got together and we sold out over 100 booths of providers that wanted to come. And we opened up the doors and we didn't know if anybody was going to show up at all. And we had about, I believe that first one was like 750 or 800 people. And we were just overjoyed because the seniors got an opportunity to hear about services that were available to them and products and all that. And it's grown over the years. I believe that last year, the last I heard was something over 1,200 seniors had come on that day. So it's a marvelous day. You'll have a good time. And that event and all these other events can be found in the Best Times.
Oh, absolutely, absolutely.
And so when does the Best Time usually come out? The first of the month?
The first of the month, and it's at over 220 locations in Memphis and Shelby County, and we've just increased our footprint to include Oxford, Mississippi, Covington, and Dyersburg, and Ripley, Tennessee.
How wonderful. So look for the Best Times in all these places and you'll have a great time. And seniors, call the Best Time as reminders of these opportunities. And thank you for being with us today for the Mentors program. If you're interested in the air dates of Mentors or any other show on GHS-TV, go to Channel 19 or visit ghstv.org, where they're also streaming live 24 hours a day. Also, you can keep up with GHS-TV by visiting us on Facebook and Twitter. I love this quote from Winston Churchill, great Prime Minister of England and a wordsmith of the First Order. Don't worry about avoiding a temptation. As you grow older, it avoids you. See you in December.